Okay, joining me in studio now is Dr. Bill Callahan, Jr. He's board certified with the American Boards of Psychiatry and Neurology. He's also a member of the Orange County Medical Association. And Bill, welcome to the program.
Thank you. Glad to be here.
Now, Bill, we just looked at this somewhat disturbing piece about teens and adolescents being more prone to having bouts of serious depression, especially if they have a parent who's suffering from the same thing. And because of your expertise, I was kind of hoping to get your input on that.
Yeah, I think the one thing that comes clearly out of the piece is that prevention actually works. And so they're talking about being able to do some group therapy work in advance with kids who are at risk because they have a parent with a history of depression, and actually preventing those kids from becoming depressed and having health effects themselves. A lot of times people don't think of us being able to do prevention in psychiatry, but we actually can.
Well, it's really interesting because, of course, you know, we live in times right now where there's a lot of stress, there's economic stress, there's all kinds of things that are affecting us that, say, weren't affecting us even 10 years ago. And that can put a lot of burden on the parent.
Mm-hmm.
The child is seeing the burden on the parent, and it becomes a vicious cycle, doesn't it?
It can, but it doesn't have to, because treatments really work in psychiatry. So those parents who get help, whether it's medication help, whether it's psychotherapy help, whether it's a good exercise routine, all these three things have been shown to make an amazing difference. In fact, we can do better treating the brain for depression and anxiety than I used to when I was treating the heart and the blood pressure. But the problem is people wait too long. They wait until they're really ill and this dark cloud has settled over the house. They no longer have the energy to do things they used to. They're losing touch with their kids and becoming irritable and hopeless about the future. And that's setting that whole pattern into the children who are exposed to that day in and day out, and that can affect their entire development and even their health status later on in life.
Well, Bill, is there a kind of a stigma that people are afraid to make that leap into emotional treatment or mental treatment, so to speak? I mean, do you see that in your practice?
Very definitely. And I'm someone who left a career as a flight surgeon in the military to go into mental health because I saw in treating the troops in Panama in the first Gulf War how critical emotional health is. We're really feeling phobic. We're afraid of emotion in our society. We're very cognitively thinking focused. And so many things in life have an emotional component. So when we say the word stress, we're really talking about the upper level of what underneath is tons of emotions. When we look at what's happening in our economy, these families are going through tremendously anxiety-provoking, but also sadness-causing and sometimes anger-causing events. And we sometimes don't like to deal with those feeling things, and we do have a stigma still, unfortunately, about getting brain treatment. But brain treatments really work, and like every other part of medicine, the quicker we get treatment, the easier it is to get well, the faster we do it, and the simpler it is.
We've got a little bit less than a minute left, Bill, but how can we recognize the symptoms to the point where we can get past the stigma and pick up the phone and ask somebody for help?
Yeah, I think the first thing is when we look at function changes. So when you don't feel like working anymore, when you don't have the energy to pay attention to your kids, when things you used to love become uninteresting to you, when you lose your interest in sex, when you find you can't get up and exercise, or your weight is going out of control, because that's often a big part of it. Certainly by the time you start thinking about killing yourself or wishing you were dead, but that's a very late stage. A lot of it's trouble falling asleep and anxiety, and that sets off a vicious cycle of less and less energy, more and more stress, and then propels you into depression.
Sage advice. Thank you so much. Again, Dr. William Callahan. Of course, he's a member of the Orange County Medical Association and appears here courtesy of them. Thank you so much.
Thank you, Don.